Assalamu alaikum wa rahmatullahi wa barakatuhu. MashaAllah. Welcome back to Your Health, a health program which tries to achieve, alhamdulillah, an increase in its viewers' health by the grace of Allah via natural means. Before the break, I was suggesting to yourselves the importance of vitamin D. Now, vitamin D, alhamdulillah, is very, very important for many things. Now, where can you find good sources of vitamin D from? First of all, between April and September, you can get most of the vitamin D from the sun. Half an hour produces in the sun should produce about let me give you an example. It produces about 100,000 IUs. It's staggering what it produces. 100,000 IUs just by half an hour, being half an hour in the sun. Which is really amazing. And the doses, you're being recommended are 4,000 IUs. So where's 4,000? Where's 100,000? Okay. In fact, if I suggest to you, and this is just just exchange of information, if you take 100,000 IUs every single day for a whole year, in fact for 13 months, it will just add up to 1 gram. 1 gram. Yeah. It's amazing. So obviously, vitamin D, do your own research, and then the biggest thing I can suggest to you is do your own research and look into vitamin D. It's phenomenally good, but as we say, do everything under and alongside your GP supervision. So natural sources of vitamin D, you have it in margarine, you have it in things like certain, you have meats have vitamin D. And then again, the sunshine. So the best way to get vitamin D is from supplements, alhamdulillah. Okay, now the topic today was about diabetes. Diabetes is there's about 200 million people worldwide with diabetes. 200 million diagnosed people. We don't know how many people aren't diagnosed. So 200 million people is a lot of people. Now, what is diabetes? Diabetes is a medical condition where you have, excessive sugar, glucose in your blood. Okay. Now, the important thing to understand is that everybody needs glucose in the body. If you didn't have glucose, you'd be dead. Every cell needs glucose for it to function. You can only hear now because you've got glucose in your body, and that's producing, it's going into the cells and helping you listen and help you process and just be alive. Now, when you have more glucose in your body than you need, that is diabetes. Diabetes means overflow. There's two types of diabetes: diabetes insipidus and diabetes mellitus. Insipidus means, tasteless. Yeah? Tasteless, and diabetes mellitus means honey tasting. So diabetes mellitus means that the urine is full of sugar and glucose, so it's sweet tasting. Yeah? Diabetes insipidus means that there's no sweetness in it, because what happens let me explain to you. Diabetes insipidus, what tends to happen, it's a metabolic disorder. What happens is that there's something called it's a hormone, okay, antidiuretic hormone, ADH. This hormone stops you from urinating excessively, okay, ADH. Now, when this hormone is less, then you will urinate a lot. People who have this, diabetes insipidus, they can urinate 4-5 gallons a day. Now, if you look at 4-5 gallons, it's like 1.5 liter bottles. It's these people, if they don't have water regularly, they'll die within a day. So it's a very, very serious disorder. Okay, diabetes insipidus. So it's kind of what happens with this illness is that the ADH, the hormone that causes your kidneys to reabsorb the water, that doesn't work, and you are excreting up to the value of 4-5 gallons a day. Diabetes insipidus. The second diabetes, and this first one's pretty rare. The second diabetes is what 90% of people who have diabetes, they have this diabetes mellitus. It's more common in ladies, yeah, and it's more common in people over 40. And it's known as a lifestyle disorder. You know, if you ask your GP, they'd say that diabetes type 2 is incurable. Once you've got it, you keep taking your metformin and your glimepiride, and after that maybe the injections, insulin. Allah keep everybody safe. But do you remember the former Labour deputy leader, Tom Watson, I think his name was? So if you have a chance, if you Google him and look at his journey out of diabetes type 2, what did he do? He lost weight. He went on an exercise program. I think 3-4 months later, you know, his GP said to him, Mr. Tom Watson, we're glad to say you no longer have diabetes. Alhamdulillah. His diabetes went. So it's a lifestyle disease, as is hypertension, high blood pressure, as is, you know, so many illnesses, high blood pressure, diabetes. All these are caused by sedentary lifestyle. So with sugar or diabetes mellitus, as it's known as, the same way to, you know, negate this is, there's many ways. I'm going to share with you one particular way. This way is the way I use with my patients, but this way isn't for everybody. Okay, you need to be strong, you need to be quite, you know, focused, and you need to let your GP know, because this way it brings your blood sugars down to about 3.9. At which stage your GP will say to you, Mr. Abdullah, you don't need your you know, your diabetic medications, your metformin, your glimepiride, etc. Inshallah. Now, so just let me continue about the type 2 diabetes first of all. So too much sugar in your blood is no good for you. It causes an impact in your kidneys. It causes an impact to your heart. It causes a lot of infections. People who have a lot of spots on their faces, or carbuncles, not normal spots, carbuncles, abscesses, is because they have a high level of glucose or sugar in their bloodstream, and this is feeding all this bacteria which is causing these huge spots. So people who have you know, a lot of abscesses and a lot of boils in different, you know, axillary area, inguinal areas down here near the groin, they can do something substantial about it, and the thing what they can do is they can stop their sugars, and this will inshallah over 6 weeks have a great effect on them. Okay, so the symptoms of diabetes, let's look at the symptoms of diabetes. Type 2 diabetes, what happens when you have type 2 diabetes? First of all, it's known as polyuria. You will go to the bathroom excessively. You want to pass water, a lot of urine. You'll be passing urine, number one. Number two, you will have a excessive thirst. You want to drink more because you're passing more urine. You want to drink more. Polydipsia is known as. So polyuria, excessive urine, yeah. Polydipsia, when you have a lot of thirst, and then you have something called polyphagia, which means that you want to eat more. These are symptoms of diabetes, and you will have maybe your, you know, your you'll have kind of an odor as well from your mouth. Yeah, describe it as pear drop odor. You can smell this, and if this just, you know, then you can start feeling dizzy. It's very high blood sugars are very dangerous because they cause damage to, well, many things: diabetic neuropathy, diabetic retinopathy, and diabetic nephropathy. Somebody called earlier on about kidneys. I will answer his question inshallah, and also for his wife's needs in due course, so please keep watching. Now, diabetes can cause, the biggest thing diabetes can do for anybody detrimentally is it can cause damage to your kidneys. The brother called and said he's got stage 2 kidney disease. Stage 2, alhamdulillah, can be reversed by the grace of Allah. Is when you get to stage 5, when your EGFR levels, estimated glomerular filtration rate, just a kind of a method of seeing how well your kidneys are filtering your blood. Okay, now you have maybe, you know, from the top is 120, so 90 to 120, that's pretty much, you know, okay. After that, maybe 82, that's stage 1, then it goes down all to the number 14 EGFR, which indicates that you will now need dialysis. Okay, so diabetes can directly cause massive kidney problems and give you chronic kidney disease, CKD, Allah keep us safe. So if nothing else, you should be motivated to, exercise, to improve your diet, to get into the green fruits and green vegetables. If not for your own sake, then for the sake of saving your loved ones witnessing you in in dialysis. Al-iyadu billah. So the biggest thing with diabetes type 2 is that it causes massive damage to your kidneys if your blood sugar is not controlled. But I don't want you to just control it. I want you to permanently control it in a way that the body can deal with it on its own accord without you having to take these tablets. Your GP, let me add now and here, will only give you these tablets because they are certain that you are not exercising. Okay? You're not going to exercise, you're not going to change your sedentary lifestyle, so they are forced to save your life by giving you these tablets, which brings down your blood sugars. So the first effect of diabetes is that it can cause massive kidney damage. The second thing, so that's diabetic nephropathy. Nephro, you need the kidneys. That's why you call your kidney specialist a nephrologist. The second thing that they cause, again because of the high sugar causes all problems. High sugar in the blood, it's what? It's known as diabetes. High sugar in the heart is called heart disease. I'm not kidding you. A lot of sugar that reaches to your heart and causes damage there is caused heart disease. The cholesterol that's secreted by one school of thought is caused by the sugar. So high sugar in the blood, diabetes, high sugar in the heart disease, high sugar that reaches the brain, Parkinson's, Alzheimer's, dementia. Why do they call these Parkinson's, Alzheimer's, dementia type 3 diabetes? It's for a reason. Sugar is your enemy. Yeah, the way shaitan is your enemy, sugar is your enemy. And it's, as some people say, it's more addictive than crack cocaine. That you can leave cocaine easier than you can leave sugar, and try it. Don't have sugar for 3-4 days and you will be like a madman. So some people are put on this diet, and after 1-2 days I see them and they some of my colleagues, so they're like madmen looking for a biscuit. It's so hard because they want that fix of sugar. Okay, so diabetic nephropathy, kidneys खराब हो जाती हैं diabetes की वजह से. Diabetic so the kidneys get kharab, and the second thing I was mentioning, that what they can do after the kidneys is cause damage to your retina, back of your eye. Diabetic retinopathy. Diabetes can cause your vision to go because of damaging the ocular nerve at the back of your eye. High sugar in your blood is very dangerous. Let me explain to you. An adult male will have about 5-6 liters of blood. Per liter of blood you need roughly 1 gram of glucose. Okay, when it goes more than a gram, so if you ever use a glucometer and see it says 113, 114, that means you've got roughly about 1 gram per liter of blood. When it gets to 2 grams, it's high, it's too much. Why? Because unless you're doing some activity where you need a lot more. And I'm explaining this because in this diabetes diet I'm going to show you in a few moments, it's very important to understand this, that you will be eating things with that can be changed to glucose. So you'll have fruits like mangoes, you'll have fruits like all kind of fruits, sugary fruits, yeah, and oranges, satsumas, tangerines, grapes, and so much more. So you'll say, look, Maulana Sahab, how come you're making us eat things which have high glucose? But the reason for that is that your body will only allow, if you have these certain foods which I'm going to show to you, if you have these foods, the body will only convert this into glucose when a male has less than 1 gram of glucose per liter of blood. Okay, and a female, I think male have about 6.5 grams and a female have about 5.5 grams. So when you have less than 5.5 grams per liter of blood of glucose, it will allow this fruit to change into glucose and go into your blood. If you have more than this, then the glucose that's made from these foods will not be allowed to enter. And that is only with these foods. Any other foods you have, as soon as you eat it, depending on its glycemic index, it will go into the bloodstream and it will raise your blood sugar levels. Okay, then depending how good your blood sugar control is, after 2 hours, it should go back to normal. In other cases, people who've got diabetes, it won't go back to the normal reading, for hours and hours. That's why the medicines come in. So the second thing I was saying that diabetes causes is retinopathy, damage to the retina. And the third thing it causes is diabetic neuropathy. Neuro means nerves. It causes the nerves to die. And how does it cause the nerves to die? It causes the nerves to die because blood supply can't reach these nerves. When there's no blood supply, them nerves will die. मैं ये कह रहा था कि diabetes, जो शुगर हम कहते हैं डायबिटीज़ इंसिपिडस, डायबिटीज़ मेलाइटस, ये दो डायबिटीज़ हैं जहाँ आदमी के अंदर जो ब्लड शुगर है उसका कंट्रोल चला जाता है। इसकी वजूहत मैंने बताई, आदमी चीनी बहुत ज़्यादा खाते हैं और जिस तरह कोई नशोई होता है उसके लिए यानी ज़्यादा और ज़्यादा उसको नशा चाहिए ताकि उसको ये सुकून हो। तो इसी तरह इंसान के जिस्म के अंदर भी जब आदमी शुगर खाता रहता है तो इंसान के अंदर ये जो सेंसिटिविटी होती है, जो एहसास होता है इंसुलिन का, वो जाता रहता है और जिस्म को मज़ीद इंसुलिन बनानी पड़ती है, पैंक्रियास के अंदर बनती है और इतनी एक हद तक कि वो जो बेचारा पैंक्रियास है वो उस मकदार को बना ही नहीं सकता। तो फिर ज़ाहिर बात है आर्टिफिशियल ड्रग्स वगैरह के ज़रिए इस ब्लड शुगर को नीचे होती है। तो मैं ये बता रहा था कि डायबिटीज़ से 3 बड़े नुकसान होते हैं। अव्वल ये कि आदमी की जो किडनीज़ हैं वो ख़राब होती हैं, और किडनीज़ की बीमारी अल्लाह ताला सबकी हिफाजत फरमाए, क्योंकि जब किडनी ख़राब हो जाती है, चाहे एक्यूट हो चाहे क्रॉनिक हो, तो ब्लड प्रेशर बहुत ही ज़्यादा बढ़ जाता है, या फिर जब ब्लड प्रेशर ख़राब हो जाता है तो किडनीज़ फिर ख़राब हो जाती हैं। इट्स लाइक अ सर्कल। तो किडनीज़ ख़राब हो जाती हैं, आदमी के जो आंखें हैं, पीछे जो ऑप्टिक नर्व है वो ख़राब हो जाए, और तीसरी बात जो ख़राब होती है, आदमी के नर्व्स ख़राब हो जाते हैं। So when the nerves get they get damaged, then what can happen? You can even get gangrene, and when you have gangrene, they start chopping off your that area. There's very good homeopathic remedies which many homeopaths have found to be effective for gangrene. Alhamdulillah, summa alhamdulillah. Barhal, so Allah Ta'ala keep everyone safe from these complications of diabetes. We've got a call waiting. Bismillah. Assalamu alaikum wa rahmatullahi wa barakatuh. Ji Ben, wa alaikum assalam.
I was just wondering, my brother, his name's Dawood, and he's been ill for the past 3 years, and I was just wondering, is his name too heavy for him?
Is his name too heavy for him?
Yeah.
That's a good question, Ben. Dawood. It's a name of a prophet of Allah subhanahu wa ta'ala. Why do you think his name might be too heavy for him?
My mum was asking. She just asked me to say it.
No, that's okay. No, I think that's a beautiful name, Ben. His name is beautiful. And names do affect you, okay?
Yeah.
Names do affect you. One of the rights that you have on your parents, number one is a good name. And number two is, with all respect, is a good mother. And number 3 is Islamic education. But that's a perfect name. It's a name of an illustrious Ulul Azm min Rasul, a great prophet of Allah subhanahu wa ta'ala, Dawood, and that name will bless him, inshallah. So no, if he's got illnesses, Ben, it's probably, physical reasons. And
the name's fine.
Yeah, the name's beautiful. Dawood is a beautiful name, alhamdulillah. So don't be worried about that. But how old is your brother, please?
Dawood is 13 now.
Allah Ta'ala give him shifa. What illnesses does he have, please?
He's been diagnosed with psychosis.
Allah. Okay, so what else? Bipolar. So basically he's got schizophrenia, bipolar, or manic depression.
Yeah, but he wasn't always like this. It only started from when he was 10.
Oh, did you have any kind of trauma? See, this isn't the best medium to discuss this, you see. But let me share with you some of my experiences with patients I've had who've had psychosis. So please keep listening, sister. And that name is fantastic, mashallah. Okay, now what I'm going to suggest to the sister who called, whose brother has kind of, it's mental illness, and it's actually one of the severest mental illness, psychosis, known as, bipolar, known as schizophrenia, where people can hear voices, hear voices telling them to do X, Y, Z. They have a split, or they can have a split personality. They have a duality, like Dr. Jekyll, Dr. Hyde kind of thing. And the medications, I forgot to ask the sister if his brother was on any medication, but the medications like quetiapine, these are powerful stage 4 antipsychotics. And again, the GPs will give you these because he feels that you may be a harm to yourself or a harm to your loved ones. So they have to give you this. But what I suggest to my patients who are on the stage of taking stage 4 antipsychotics like quetiapine and risperidone, which are powerful. Out of stage 5, stage 4 is what they give to people with and sometimes they with the bipolar. Sometimes they even section them. What anybody can do who wants optimum health. Whoever wants optimum health, what they need to do is increase their omega-3s in their body. I'll say that again. If you want optimum health, if you have children who get angry, if you have children who lose their temper, or even if they're in the state of our brother Dawood, Allah Ta'ala give him shifa, where they have psychosis, which is a severe, probably the most severe mental illness you can get, and he's only 13. Allah Ta'ala keep him safe. Increase fish oils, omega-3 from a good brand. Google it if you want to ring in. Adil can guide you on, if I can speak to you, maybe I'll tell you the brands you need to get. And get these, so maybe 3-4 grams a day of omega-3s. Now omega-3s have two types. You have EPA and you have DHA. You need to get the EPA, and there's a company which does this. They only do EPA. Okay, again, I can't mention the name on live TV. They only do EPA. You can order this and put your brother onto this for a good 6 months, inshallah ta'ala. And if it's caused, because this psychosis many a times is caused by trauma, childhood trauma. You see something, you witness something, and it can traumatize you. As I mentioned before, you're not just a system of pulleys and pumps, you are an energy being. So please take them, ask your brother to take the omega-3s. We've got another caller waiting. Bismillah. Hello, salam. So we just dropped the call. So as I was saying, let me quickly answer the other brother who called in with the kidney issues. Brother, you got you're on stage 2, which can be reversed, inshallah. The homeopathic remedy which I normally give for kidney issues, and that can be any kind of kidney issues, whether it's ladies, STI infections, whether it's acute kidney disorders, whether it's chronic, is something called berberis. Now let me just spell this for you. Berberis is spelt B-E-R again and I-S, berberis. What you need to do with this berberis is you need to get it in a mother tincture. Okay, so if we where are we? Oops. Show this to you on the screen. Achha, it's not happening. So berberis, B-E-R again, I-S, berberis mother tincture. Get this from a reputable homeopathic pharmacy and take this 15 drops 3 times a day. Okay, take this for a good maybe 6 weeks, maybe 2 months. 15 drops twice a day. Balki, if you've got stage 2, take it 3 times a day. 15 drops 3 times daily in a small amount of water. If you take this will really be benefit. It'll benefit your kidneys, alhamdulillah. Okay, but again, it needs to be looked at professionally by a GP, by a nephrologist, as to why you've got stage 2 kidney disease. For your wife, I think you said joint pain. Now, joint pain, a very good thing for that, first of all, is a method I said before, where you get 10 ml of cod liver oil and you mix it with 10 ml of pure orange juice of a company that begins with T. Okay, you can guess. It has to be the smooth version. You put into a small baby food jam jar, you put a tablespoon of cod liver oil in and a tablespoon of this company that begins with the T, smooth orange juice. Close the lid, hit it on your hand 15 times and drink this in the morning. Do this for 6 months, and you'll be really surprised at this. The people who do this for 6 months, and I've seen many, it blows their minds away. That's the first thing. Second thing, glucosamine, sulfate and chondroitin. This is not homeopathic again. Glucosamine, sulfate and chondroitin, 1500 mgs of glucosamine and 1200 of chondroitin. This is what your it's basically it causes cartilage to regrow. So unless your the joints are completely deteriorated, it'll really benefit your wife, inshallah. So glucosamine, sulfate and chondroitin, this will really be beneficial to you. Unfortunately, we've only got last 40 seconds and I haven't had time to show you this diet. So please, join us next week, and I will, inshallah, I promise, by the grace of Allah, if I'm alive next week, I will definitely go through this diet about how to benefit you and take you away, by the grace of Allah, from this diabetes type 2. And if you've got type 1, then it can reduce your insulin by a good maybe 1/3 or 1/4, inshallah ta'ala. So in hindsight, it's very, very important to look after your health. We mentioned vitamin D today. Please do your own research. Vitamin D, by the grace of Allah, has been proven in many a study to benefit your immune health. Okay, Jazakallah khair. Please join us next week. Until then, Assalamu alaikum wa rahmatullahi wa barakatuhu.